How do we know that death is imminent? You might be asking, when will they die? How will I know that death is imminent? What am I going to see? What's it going to look like? How will I know? In this video, I'm going to talk about the signs of actively dying, what to expect, and what you can do. It's really normal to have a fear of death, a fear of the unknown. And I think videos like this, where you can learn about what to expect, what it's going to be like, gives you a sense of control and a way to prepare yourself, to educate yourself, so it doesn't have to feel as scary. Signs of actively dying. Actively dying is the last phase of life. Actively dying usually lasts anywhere from a few hours to a few days. The longest I've seen someone actively die is 3 weeks, which is very uncommon, so please don't expect this. I would say it's usually around a few days. Here's what it looks like. Your person will be mostly unconscious. Their face will look a little different because their eyes will likely be open or partially opened, but not making eye contact with you. Their mouth will usually be open, and this is because your eyes and mouth, it takes muscles to close your eyes and mouth. To blink, to hold your eyes shut, to hold your mouth shut, it takes muscles. At the end of life, especially during the actively dying phase, those muscles are fully relaxed. So the tongue might hang out, the mouth will be open, their eyes will likely be open, if not partially open, but not responding to you. So they're fully unconscious. They most likely have not eaten or drank anything in multiple days. This is something you do not have to worry about. As weird as that sounds, this is the natural process, and the less we mess with that process, the better your person's going to feel. The one thing you can do during that time, just because a dry mouth can feel a little uncomfortable, and they'll likely have a dry mouth because their mouth is open, you can moisten a sponge or moisten like a cloth and moisten their lips, their tongues, their gums, keep that moist because that will feel good to them. The other main symptoms you're going to see are changes in breathing. Your loved one during the actively dying phase will breathe differently. Almost always. They will have different breathing patterns. They're not going to look like you and I breathing. Do not be alarmed. This is a normal process of the body shutting down. It's basically a metabolic response happening in their blood that's causing them to breathe different. This is not causing them to suffer. They are not suffocating. They are not having a hard time breathing. This is literally their body slowly shutting down. Another symptom is terminal secretions. The nickname for this is called the death rattle. It's like a gurgling noise that happens with every breath. Now, why is this happening? This is happening because our body creates saliva to moisten the mouth. It's happening as you're watching this video, as I'm speaking in this video. And then our bodies will automatically, our brain will tell us to swallow that saliva, like I just did. At the end of life, that stops happening. So the body is still creating saliva to keep the mouth moist, but the brain is no longer automatically telling that person to swallow the saliva. So it's collecting in the back of their mouth, causing that breath to go over that little bit of saliva usually, and it's causing a gurgling noise. It is not hurting your loved one. They are okay. They are not bothered by it. However, it does sound bad. So there are things we can do, usually positioning. So I would say we could put their head a bit up so it changes the position of the saliva. You can roll them to their side. That causes the saliva to come out of their mouth. You could give them medication that dries up the terminal secretions. At the end of the day, just know that it's a natural part of the death and dying process and it's not bothering them. If your next question is, how do you know it's not bothering them? Great question. It's asked all the time. We know because a dying person will show us if something is bothering them. They cannot verbally tell us, but they will show us physically with their body. So that would look like them being restless, them having a furrowed brow, or like really looking upset. They will physically show you that they are uncomfortable. So if they are laying there and they look like they're sleeping and they're not really moving and you can touch them and they don't wince, nothing's going on, they are okay. So that is how we can tell, non-verbal cues. Another thing you might notice during the actively dying phase is changes in skin color. The first place you'll see this is the fingers and toes. It's called mottling, and a lot of times it'll show up as like purple or gray fingers and toes. Sometimes you'll notice it on their knees, and every once in a while you'll see it on their nose. Their nose may change color as well, like the tip of their nose. And it'll look a little purplish, a little gray, dusky maybe. Again, all very normal, and expect this to happen. And the last but not least will be changes in temperature. This is happening because our body has a sensor that basically controls our core temperature, which is why most of us have a temperature around 98.6 degrees. But at the end of life, that starts not working anymore. So the temperature will fluctuate. So they could feel hot but be cold but feel hot. Fevers at the end of life are very normal. Many times we don't do much about this, except for if they do feel hot or they are having a fever, we can use cooling measures like a cold cloth on their forehead, behind their knees, anywhere they have like pits will feel good if you put a cold compress there. Also, Tylenol suppositories can be used at this time if they do have a fever and they seem uncomfortable. Everyone dies differently. Sometimes there is this transition into the actively dying period, which can prepare you and like ease you into it a little more. Sometimes it can happen pretty suddenly, which can feel really scary. So the main point of this video is to help people not panic during this time, because when you see something scary and it's your loved one, your first response is to panic, do something, we need to call someone, we need this. And really, this is the time specifically now to really be with your loved one. You don't have to do much, especially if they look comfortable, except for be there with them. You keep them clean, you keep them safe, and you keep them comfortable. This is the time to just be with your loved one despite how uncomfortable it may feel. I do have a number of videos where I show what this actually looks like, real life actively dying videos. So if you are interested, I suggest you go watch those. I think preparation for this time is key. We want to be present with our loved one dying. We can be more present and less afraid when we really know what to expect, what it really looks like to be actively dying, and then how we help and what we can do during this time. Those videos will help you, so check them out.